Here at Alternative Foot Solutions, we see bunions every day. Bunions are so common now that the latest studies suggest that over 1 in 3 Australians suffer from this condition. We hear stories about bunions causing pain or stopping women from wearing the shoes they love. What's incredible is that most people, including your doctor, think that the only way to fix a bunion is surgery, when this is simply not true. And in this video, I'm going to show you proof that we can fix a bunion naturally. So, what is a bunion anyway? A bunion is a deviation of the big toe, where the joint comes out of its natural alignment, which can then result in bony changes, giving you a lump on the side of your foot. In many cases, they do result in pain, but many bunions will begin to deviate without pain. The problem with this is that when they do start to hurt, it can be too late to treat them effectively. This is why, if you have any signs of a bunion or someone in your family has a bunion, we suggest getting it treated as soon as possible. Bunions are caused by the alignment of your joints and the way that you stand and walk. There is also a hereditary link with bunions because family members often tend to stand and walk the same way, and there are even similarities in the alignment of their joints. At Alternative Foot Solutions, we correct bunions all the time. In fact, 60% of our patients attend our clinic for bunion correction. We address the long-term cause of the bunion through a gentle hands-on technique that guides the joints back into place and then strengthens the muscles around that joint to reinforce that corrected position. By addressing the alignment of the joint as well as the way that you stand and walk, we are able to not only address the underlying cause, but also create long-term lasting change. With every patient we treat for bunions, we take an X-ray to measure the level of misalignment so that we can offer the best level of care. So let's have a look at some before and after X-rays to show how effective this treatment can be. We treated Pam for painful bunions and she also suffered from osteoarthritis. She came to see us because her feet were very painful and she couldn't wear any fashionable shoes. We sent for X-rays and this is what we got. Now keep in mind that the ideal reading for a straight toe is between 12 and 15 degrees. With Pam's toe sitting at 32 degrees, I'm sure you'll agree we had some work to do. After the initial phase of her corrective treatment, we re-X-rayed to measure the results, and I'm happy to say that we had a 7-degree reduction. Keep in mind that this is only after the initial corrective phase of the treatment, so the best is yet to come. Not to mention, Pam has no more pain. Here's another great example. This time we are looking at Diane's X-rays. Diane was having pain and was also worried about having to have surgery. Her initial deviation was 28 degrees. So again, there was a lot of work to be done to get it back down towards that 12 to 15 degrees. After the initial phase of treatment, we were able to achieve a remarkable improvement, correcting the joint by 10 degrees. This is even better when you consider that Diane didn't have to stop doing activities and was able to keep wearing the shoes that she loved. Down to 18 degrees, and the best is yet to come. Only 3 more degrees until we have a straight toe. Now, there are 3 common questions we get asked in relation to getting treatment for a bunion. Number 1, can I still exercise? Most definitely. You don't need to change anything. Because we are addressing the underlying cause, this allows you to exercise freely and you will be less prone to injury. Question 2, can I wear heels? Absolutely. And that's why a lot of people attend our clinic, to wear the shoes they love. Now, I'm not saying that heels are good for your feet, but our treatments will minimize the damage that they may cause by realigning and strengthening the muscles around those joints. And question 3, how long does it take? The amount of time varies depending on the level of misalignment that is involved with each bunion. However, I would definitely say that we are usually able to treat people over a single cycle of treatment. And while the length of that cycle varies from person to person, it is usually shorter than you might think. We really need to assess you properly to give you a better idea. In fact, to make sure we give you the best level of care, go ahead and enter your details into the booking form here on the website, and in return, we'll give you a free bunion assessment where we can give you a better idea of how long it might take to correct your bunion. We offer this because we believe that it's important to fix your bunion as soon as possible, so you get the best outcome and avoid surgery. But we also accept that the treatment needs to be tailored to your individual needs. So go ahead and book in for an assessment now. You've got nothing to lose and only pain-free, healthy feet to gain.